Thank you, Representative Schlossberg, and thank you, Secretary Miller, Dr. Levine, Deputy Secretary Vicari, and of course, again, to my good friend and former colleague, Representative Mike Schlossberg, for coming together to highlight an important issue that's facing our Commonwealth. And I can tell you that addressing mental health challenges at every age is not a partisan issue. Last year, I was so pleased to partner with Representative Schlossberg to assist in pushing through Act 110, a new law that requires higher education to make our mental health crisis into a top priority on our college campuses. In fact, Representative Schlossberg and I toured the Center for Collegiate Mental Health at Penn State University, and we met with university leaders at the end of last year to get a firsthand look at how our state's largest university is addressing this problem. And to say that we were overwhelmed, well, that's an understatement. Penn State has found that as they continue to expand their services for students dealing with mental health challenges on campus, that they are reaching maximum capacity almost instantly. We have a real problem that is adversely affecting our college students ages 18 through 22, and it's only getting worse. And I look at my own Senate district. I have the great honor of representing the 28th Senatorial District, and I don't think I even introduced myself, did I? I didn't. So I'm Kristen Phillips-Hill, and I'm state senator from the 28th District in York County. And what I can tell you about York County is that we had 92 suicides in the last year alone, and it's at an all-time high. But to the mother or the father, the sibling, the grandparent, or other relative, loved one, it's not a number. That's a person that they care about whose life was cut short too soon. And unfortunately, more and more individuals, especially younger children, hide their problems until it reaches that crisis stage. And thanks to the investment at Penn State and other areas of higher education, we're able to address it before it's too late. But we can and we must do more. Today and this week, but more importantly, every day, should be Mental Health Awareness Day. People should not be afraid to know where or when to ask for help. And something has to change. We have to stop stigmatizing mental health challenges, and we have to drop the labels. Mental health is as serious as physical health. And to no one should be afraid to talk about how they're coping with a problem or the loss of a loved one or the loss of a job or anything else that's challenging them. And with the leadership of Secretary Miller, Dr. Levine, Representative Schlossberg in the House, along with many others in this building, I believe we can address those challenges of our next generation. We should not be sending our children off to college for their mental health challenges to peak and become the problem of our universities. And through our conversations with various stakeholders, we have seen that the next step is building resiliency for children at an earlier age, so that we address this problem sooner rather than later, because our future counts on it. And with my esteemed colleagues who are here today, I know we can make this a priority to provide the tools, the help, the resiliency that the next generation needs. Thank you so very much.